Hi, teacher.
Okay, so are you ready for our class now?
Yes, I'm ready. Thank you.
Oh, that's very good. Let me just give here. Now,
Oh, I can't hear. Can you repeat your question?
can you hear me now?
Yes, I can.
Okay, that's very good. Let us start. How are you today?
Today I'm quite good. I'm apart from blue. I'm blue in 4 days. So today I'm feel good.
That's very good. I'm glad to hear that. Okay, so let us start our lesson now. But may I ask you a few questions? Did you eat your dinner already?
Yeah. Yes.
Oh, that's perfect. Very good. So let us start now. Last time we talked about irritable bowel syndrome. You still remember that? Irritable bowel IBS.
IBS. Yes.
Yes, we talked about that last time. So right now, we are going to continue.
Yeah.
Let me share my screen. Now, can you see my screen? This one? Yes, can you see my screen, dog?
Yeah. I
Okay,
can.
that's perfect. Now, let us start with our very first video. Let me check first. This is our first video. English for doctors inserting an intravenous cannula. This is the IVF. Okay, I will play it now.
Oh.
Okay, this one.
Mr. Herbert, I'm going to put a cannula in your arm now, so we can give you some IV fluids because you're a bit dehydrated at the moment.
Yes. I haven't been able to drink anything. I feel sick every time I have even a sip of water.
Yes, it's been very unpleasant for you, hasn't it? After I put in the cannula, I'll be able to give you an anti-sickness injection straight into your vein. It'll work much faster that way.
Okay, thanks. I hope it helps the sick feeling. I can't stand much more of this.
All right, I've washed my hands and put on some gloves, so I'm ready to start. Can I ask you to put your left arm up onto the pillow for me and turn your arm over so I can check for a vein near the crook of your elbow?
Okay.
I'm just going to wrap the tourniquet around the top of your arm. It'll be a bit tight for a while, I'm afraid.
That's okay. I know it's not for long.
Just relax for me while I feel for a vein. Okay, that's a good vein there. I'm going to clean the area with this alcohol swab. It'll feel a bit cold at first.
Oh, yes, it is cold.
Right, it's dry now, so I'm going to put the cannula into your vein.
Okay.
All right, keep still for me, please. You'll feel a slight scratch now. That's it.
Is it in now?
Yes, it's in the vein. I'm going to release the tourniquet now, but I'd like you to keep still until I've secured the cannula.
Okay.
I'll just put a transparent dressing over the cannula site so we can keep an eye on the cannula.
So, I can have that injection for sickness now, can I?
Yes, you can, but before I give you the anti-sickness injection, I have to flush the cannula to see that it's working properly.
Flush? What do you mean?
It's just some saline, which I inject into the vein to make sure it's open and ready to use. Then I can get the other injection ready for you.
Okay, so we are done with the video for a while, please.
Hello? Can I speak?
Okay, let's go now with the questions. Okay, this one, let us start with comprehension questions first. Let me change this into Vietnamese. Okay, so our very first question is, what is the purpose of an IV cannula?
Oh. the purpose of an IV cannula is transfer transmit water, drug, or blood into the body.
Okay, thank you very much for that answer, though. So it is to transfer blood. Am I right? Did I hear it right?
Yeah, transfer blood, water, and drug.
Oh, okay. Now let us go to the next question. This one. Here.
Tại sao bác sĩ cần chèn một ống thông IV cho bệnh nhân?
Oh, because the doctor needs give need to manage drug abuse and the water enough to the patient.
Yes, so it is for the patient's health. Patient's, let me check here. Patient's wellness.
Wellness.
Sorry. Is for the patient. Let me check again. Doc, can you see me?
Yes.
Yes, okay, very good. Now, let us go to the third interesting question that I see here. Oh, okay, this one. The third question is that what information does the doctor, here, let me share to you.
Bác sĩ cung cấp thông tin gì trước khi làm thủ thuật?
The patient needs apply give the information such as the name of patient, the name of the doctor, check the patient's name, patient's information, and say about drug, the water, and the ways to set a cannula, IV cannula.
Yes. So is it important, Doc? What do you think? Is it important to provide the procedure before doing it first? Let me translate that. Is it important?
Oh, yes. It's very important because to check the information avoids the false
Yes. To avoid malpractice. To avoid malpractice.
Yes.
Yes.
And when the patient understand these procedures, they will agree and yes, and the patient and the doctor can do procedures successful.
Yes, okay. So information is very important when it comes to things like that for the patients to be well aware of the practice. Okay, that brings us now to the fourth question.
Làm thế nào để bệnh nhân trả lời giải thích của bác sĩ?
the person should ask the doctor any information that he can't understand.
Yes. Do you think that is important to ask the doctors? Let me translate that. Is it important? Is it important to ask the doctors?
Yes, because the person needs collaborate with the doctor's procedures.
Yes.
If he is quite scared, his the procedure can not successful. Unsuccessful.
Okay. So when patients are asking about the information over and over again, well, is it advisable for doctors to stay calm and patient? This one?
Yeah. Yes. The
Mm.
doctor can give advice to stay calm and to stay calm the patient.
Yes. Okay. This will bring them into a empathy. We call that empathy.
Yeah.
Yes. Okay.
Find
So
the empathy from the patient.
yes, that's right. Now let's go to number 5. Let me translate that first. This one, it says, what steps does the doctor take to ensure the procedure is safe and comfortable?
I think the doctor could need explain clearly, slowly, for the patient about the reason procedures and explain about the ways to done way to do.
Okay. So doc,
And some and a few complications may be complications.
yes, about the complications. That is very interesting. So now, Doc, I have a personal question for you. Have you experienced someone who really tested your patience when it comes to hospital setups? Hospital, oh, this one, setups. Okay, this one.
Yes, the patient often nervous when we when they have to face procedures. I often explain the patient and I ask them uh, have you any question for me? Yes, and I will explain every question um, in the procedure before the procedure. And lastly, I ask the person write Committed person to
Mm.
before the procedures.
Yes, so that is a very nice experience. Okay, so now let us see if what are the critical thinking questions. Let me give you 5 critical thinking questions. Let's start with the 6th question. Why is it important for a doctor to explain medical procedures to patients beforehand?
Because explain medical procedures beforehand is is about lawful.
Lawsuit.
Yeah.
Lawsuit.
It's a first step of the um, medical procedures.
Mm.
Explain is a first step of procedure.
Doc, are you talking about legal suits?
Legal suits. Yes.
Yes, legal
Yes.
suits. Actually, here in the legal field, in the Philippines, I read multiple cases about that. Multiple cases about non-disclosure of the procedures that led to malpractice. And that is very sad. And that is very sad. Okay, so it is really important to tell the patient first.
Oh,
Yes. So it is very important to tell them first. Okay, thank you very much, Doc. Now we can go to the 2nd or the 7th question. What are some possible risks or complications of IV cannulation? Okay, this one, Doc. What are some possible risks? Yes.
Oh, some complications of IV cannulation. The first, the patient could suffer from allergic condition or allergic shock.
Mm-hmm.
The 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 second complication could be as bleeding or
Let
hematoma.
me, yes. Let me check again, Doc. Did you say hematoma? Did I hear it right? Yes.
Bleeding
Okay.
or hematoma. Yeah.
Mm-hmm. Yes. So,
Uh, the person also uh, also could could, could also face to overload
mm-hmm.
the load the solution
Mm.
lead to
Oh.
lead to hash value
Mm.
yes.
Wow. So, is the risk or the complication dangerous?
Yes, it's very dangerous if
Oh.
the overload watering
Will it lead to death?
pulmonary acute pulmonary edema.
Oh,
overload
edema. Yeah,
overload
edema.
solution IV could lead to acute pulmonary edema
Can
and
lead to edema.
edema. Yes. Yes.
Mm, yes. Okay. Wow. That is really dangerous. Okay. Now, How can a doctor reassure a patient who is anxious about the procedure? Let me put it here in the translation. This one. How can a doctor reassure a patient who is anxious about the procedure?
Oh, we as the doctor often give information about benefits of the procedure, and benefits is better than unbenefit. Yes, yes.
Do you think, Doc, it helps if the doctor will talk with the family member?
Yes, the number of benefits of this procedure.
Okay, wow. So let us now go to the 9th critical question. If a patient refuses IV insertion, what alternative options might be available? Let us cover that question.
Oh, if a person refuses IV injection, the person could alternative drugs such as pills, a tablet, to
Alternative drugs.
yes, to alternatives medicine, yes, tablets to alternative IV solution. So the effect is less than IV solution, and the person have to accept it.
Wow, that is really.
Yeah.
The good thing is that there are alternative drugs. Okay, now let us go to number 10, critical question. How can a medical professional improve their communication skills in situations like this? Let me translate it here. How can a medical professional improve their communication skills in situations like this?
Oh, I think the medical personnel need some talk 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 to the person many times and slowly, clearly, and
slowly and clearly. Okay, that is good. Slowly and
persist. Yes, and explain the persistently.
And explain persistently, if I heard it right. Persistently.
Yeah.
Okay. Or we can say, we can explain continuously. We can use that one. Continuously. This one, yes. And explain continuously. Okay. So let us now go to the next video, Doc. I'm going to show it to you. Okay, this one.
Hello? Can I speak to Mr. Hodgkins, please?
Speaking.
Oh, for a while,
Mr.
please.
Hodgkins, it's Veronica.
Okay, let me make the screen big enough. Let's start again.
Hello? Can I speak to Mr. Hodgkins, please?
Speaking.
Mr. Hodgkins, it's Veronica Garcia here. I'm the RMO at Winston Private Hospital. I'm calling because I'm a bit concerned about one of your patients. It's Mrs. Townsend in bed 14. I don't know if you know who I mean.
Ah, Mrs. Townsend. Can you fill me in a bit about her?
Sure. She's a 45-year-old woman who came in 3 days ago for an open cholecystectomy. You may remember that she wasn't a candidate for a laparoscopic cholecystectomy.
Oh, yes. I remember her now. Is there any relevant past medical history I should be aware of?
Yes. She suffered from cholecystitis for quite some time and had a very large gallstone removed a few days ago, as I mentioned before. The size of the gallstone was the main reason for open surgery rather than keyhole surgery. In addition, she has a long history of alcohol-related cirrhosis of the liver. She had a recent chest infection, which was treated by her GP. I'm concerned about her now because she's in a lot of pain, despite using her PCA regularly. She's had quite a few breakthrough doses of analgesia, but is still complaining of localized pain around the incision site.
Her temperature?
She's been spiking a temperature between 38 and 38.5 over the past few hours.
Okay, you said she's got a lot of localized pain around the surgical incision.
That's right. She seems to have more pain than one would expect, even with open surgery. One of the nurses also asked me to check her wound. She noticed that it was very red and had an offensive smell. The redness has been spreading, and I'm a bit worried about the possibility of a collection or abscess.
Yes, I see. What are her other obs like?
Her BP's elevated and she's tachycardic. She's also quite breathless. Her SATs are running around 95–96%.
Okay, and her urine output? Is she passing urine okay?
Yes, no problems there.
Lungs okay? No sign of chest infection?
She is coughing a little, but she hasn't got a productive cough. She says that she has been coughing like this since her chest infection, the one I mentioned before.
Okay, so she's febrile and tachycardic. Her BP's up and her SATs are down a bit. No sign of chest infection, but the wound doesn't sound good.
That's right. It's the wound I'm most concerned about, and the fact that her pain is not controlled either.
Can you send off some blood cultures immediately?
Ah, yes, I should have mentioned that I've already done that. I'll phone you as soon as I have the results.
Great. Can I ask you to send off a wound swab too? She'll need to start some IV antibiotics straight away. Can you sort that out for her now?
Sure. I'll put in a line and get the antibiotics started.
Can you let her know that I'll come by and see her this afternoon?
Certainly. I'll start some IV antibiotics and ask the nurse to send off a wound swab. Is there anything else you'd like me to do before you come this afternoon?
Just ask the nurses to keep an eye on the wound and check her obs hourly until I come by. I'll probably be there around 3 p.m. after I finish my clinic. If her condition deteriorates, let me know immediately, won't you?
Yes, I'll do that. Thank you. Bye.
Okay, that's done now.
I need to take...
Okay. Let us answer some questions, starting off with what is the purpose of using S-bar format in medical communication? Let me translate that one. This one. What is the purpose of using the S-bar format in medical?
I don't know the meaning of SBAR.
SBR, let me check the meaning of it. SBR. Okay, since I'm checking it first, let me see. SBR. I'm checking it here. S-bar template. S-bar communication. This one. Okay. Let me share to you my screen again. SBAR is this one.
SBAR, tình huống Background Assessment Recommendation, là một kỹ thuật để đóng khung các cuộc trò chuyện về các điều kiện và hành động của bệnh nhân.
We don't use SBAR in America, in Vietnam.
Okay. So because of that, we can change the question. We can go with if the consultant disagrees with the hospital's recommendation, let me share my screen so that you can see the next question. For a while, please. This one. This is the question. Control V. Here. Let me share it to you. If the consultant disagrees with the hospital doctor's recommendation, what should the next step be?
Oh, consultant.
Mm-hmm.
It's not a doctor.
Oh,
The doctor.
yes, it is a doctor. Consultant is next to the resident.
Oh.
Like for example, in international standard of in the hospital, we have the intern. And then after the intern, we have the residents, those that are in the residency. Oh no, we have the PGI graduates, postgraduate interns. And then we have the residency.
Yeah.
Yes. And then we have those for the consultants. Yes,
Yeah.
the consultants
Oh, I think
or
intern.
professors. Yes, okay. So what do you think, Doc, will happen if the consultant disagrees with the hospital doctor's recommendation? This one.
If the consultant is don't agree with the doctor, medical doctor, he he should ask other 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 doctor.
Okay. So that is very important that they agree to each other. Yes. Okay.
Doctor. To find
Now,
a good way.
okay. Now, Doc, can we proceed to the next question? Let us proceed to the next question. The question here is, how does the hospital doctor describe the patient's situation? Let me proceed in the video.
The hospital doctor describes the patient's situation in a case study. A form of a case study. The reason of patient, the history, medical history of patient, the symptom of patient, on vital size of patient, and and information about when examine the patient, and some procedures and drugs that are used for patients, and yes, after then he asked the consultant about the way to control the case, medical case. Yeah.
Yes, okay. So the doctor described it in a clear, describe it in a brief and concise type of answering. Brief and concise.
Mô tả nó một cách ngắn gọn.
Yes, it is brief.
Summarize, but it's enough information to describe the case study the medical case.
Yes, that's why we highly encourage it to be brief and concise. Okay.
Almost information and size and symptoms. and some procedures and medications.
Yes. Now, let us go to the key background. What key background information does the hospital doctor provide? Let me put it here. What key background information does the hospital doctor provide? Yes.
The name of patient, the age of patient, the reason he go to hospital, on the symptoms, and on the vital signs, temperature, pulmonary rate, heart rate, blood pressure, and yes, and Glasgow score.
Oh, wow.
Head score. Yes.
Yeah.
And on history, medical history of patient. And
Medical history.
yes.
Okay. So I take the part of medical history. Now, let us
Medical
go.
history.
Yes. Okay. So let us now go. Oh, are we okay already, Doc?
Yes.
Yes. Okay. So let us proceed to the next part of this one. After SBAR communication, again, SBAR. Oh, let me share to you my screen. This one. So SBAR means situation, background assessment, and recommendation. Okay, so
yes.
So let me show you this one. This is an Institute for Healthcare Improvement. Yes, this one, SBAR, is an easy to remember concrete communication mechanism for framing any conversation, especially critical ones requiring a clinician's immediate attention and action, and can be used as a tool to foster a culture of patient safety. Okay. So let me check. Yes, we can watch this next time. I think they are using this in Europe as well as in the Philippines. Yes. Okay.
I don't know about it.
Okay, so we can now continue with the next video. This is all about lifestyle changes. Let me play it, please. Okay, this one.
Mr. Goddard, I'd like to have a chat with you before you go home, if that's okay.
Okay, Doc. I really don't think I'm ready to go home, but they must want the bed, I guess.
I know it's hard to go home when you don't think you're ready, but I think we've done all we can here in hospital. We need to look at how you can manage things at home now.
Well, that's exactly why I'm worried. I know you can't cure the COPD, and I know I haven't got a chest infection anymore. It's just that I get very breathless, even when I do the smallest thing, like walking to the bathroom.
Unfortunately, you were exposed to asbestos when you were working in the dockyards, and the fact that you were and are still a heavy smoker means that your health has been affected quite badly.
The asbestos wasn't my fault, and I guess the smoking wasn't entirely my fault either. They almost encouraged us to smoke. It was certainly a lot cheaper then. I was hooked very quickly, and look where it's got me.
Yes, it must be very difficult for you. Can we talk about some things which you may be able to do to help when you get home?
Is there anything I can do to help with the breathlessness?
Firstly, I'm going to arrange for you to take a nebulizer home, so you can use it every day. It's just like the one that the nurses have been using with you while you've been in hospital.
Oh, right. Yes, seems to work better than using the inhalers.
That's right. Before you go, the nurses will explain to you how to use the nebulizer. The other thing I'd like to talk to you about is making some lifestyle changes.
Lifestyle changes? What do you mean?
I'd like to talk about the possibility of reducing the amount you smoke. It would obviously be a good idea if you could quit smoking altogether, but I realise that it's probably not practical.
I can't tell you how many times I've tried to give up. But when I do, I get very anxious and angry. You know, not good to be around.
Smoking is a very difficult thing to give up. How many cigarettes do you smoke a day at the moment?
Well, around 50 a day. No, if I'm honest, it's more like 60 a day. I'm not proud of it, I can tell you.
I appreciate your being honest with me. Would you be willing to cut down? Even reducing the number of cigarettes you smoke each day by a few will make a big difference in the long run. What do you think?
You mean cut down bit by bit?
That's right. Have you tried any of the quit smoking programs? They're quite good for keeping you motivated.
I did try a program once. Then I thought I could do it myself. You know, go cold turkey.
I'll write a prescription for the gum for you and add it to your discharge medications.
Yes, okay. I could give it a try.
We'd like to see you at the Pulmonary Rehabilitation Clinic in a month's time, if that's okay. Just to see how you're managing with the nebulizer and the gum, and to check if you've been able to cut down at all. Can you make sure that you see the ward clerk before you leave and get an appointment for the clinic?
Thanks.
Okay, they're looking at each other.
Sure. Thanks, Doc. I'll see you at the clinic.
New surf backon. Mas bigatin na. Kaya mas mabango.
Okay.
The Dementia Dog Project is a collaboration between Alzheimer's Scotland.
Okay, so let us have now some questions before we end this class. Okay, that's fine. Okay, so what can you say about the video, Doc?
The video says about advice for just lifestyle. The doctor give some advice about stop smoking, do exercise 45 to 65 for 16 minutes a day.
Yes, okay. And he is smoking. Yeah, he is smoking so much every day. That's why it was advised for him to cut his smoking. Okay, so do you have a patient that is also a smoker, Doc?
Yes, many patients in my hospital has have smoking in for several years. For
Wow,
many years, for many years.
for many years. So are they
Yes. And the person in Vietnam also drink alcohol so much.
Oh, wow. So, yes, that is a very interesting point that we can talk about next time, Doc. I will meet you again next Tuesday and we can talk about lifestyle changes. Okay, Doc?
Okay, teacher.
Okay, thank you. Good night, Doc.
See you, teacher.
Okay.